Good right afternoon, everybody. This is Eric Saviano from Enroll Nebraska and Nebraska Appleseed. Welcome to the presentation, and we appreciate you all being here. We have about an hour today to talk about general assistance in Nebraska, which is a financial assistance program that each county has on their own. We will dig more into it with an expert on general assistance here from Nebraska Appleseed in just a minute, but let me give you a couple of housekeeping items. So first of all, you are all on mute, so speak freely, but pay attention. You also have a chat box where you can communicate with the presenters on the right-hand side of your screen. Please feel free to write anything during the presentation, but we'll have a definite Q&A session at the end. We'll also try to incorporate your participation through the chat box in a couple of instances, specifically at the beginning, so pay attention to that, and we will go from there. I believe that is all of the information we need to share with you before we get started, so without further anything, I am going to introduce Molly McCleary, who's a staff attorney here at Nebraska Appleseed, which is the housing organization for Enroll Nebraska. So we are a coalition led by Nebraska Appleseed, and I am a Nebraska Appleseed employee, just so folks know. So without any more talk, I will turn it over to Molly, who's going to share more about Nebraska General Assistance.
Great, thanks, Eric. So as Eric mentioned, my name is Molly McCleary, and I am the healthcare staff attorney here at Nebraska Appleseed. I included photos of Eric and me, so we're not just faceless voices on the phone today. And this is also our contact information, so if there is like a one-on-one sort of individual question about a client you have run into, or something like that that makes more sense to follow up via email, you have our information there. So before we begin, general assistance is really dictated on the county that you are located in. The ins and outs of how it works and what types of services are provided will really depend on where you're located. What I tried to do today was go over the general rules that we have at the state level. So there are some state statutes that dictate what every county must do. And then each county has authority to kind of set its own rules and regulations and processes. And to the extent that I could include local examples or county-specific examples, I did. Unfortunately, the rules for most counties are not easily accessible. And so that's why, as Eric mentioned, I want to, as much as I can, bring in participation from folks who are participating on the webinar today. I think that you all in working in your communities and being kind of on the front line of these issues know the ins and outs of programs and know how things work really well. And so I would love to hear your experiences or your questions or thoughts throughout the webinar. There'll be a couple places where we'll ask specific questions to kind of try and get a good feel for who's participating and comfort level with this topic. And so, yeah, that's just kind of the intro piece. Also, one other thing to note about general assistance is that this is a really, really old program. It's a really old set of statutes and case law. If you go back and start digging through the law on this and trying to figure out kind of what's allowed and what's not allowed, a lot of the terminology that's used is not terminology that we use today. For those of us on the webinar who work in this field and kind of work in poverty law or in social work, we know that language is really important, and how we speak about things now may not be how it's reflected in some of that really old stuff. So just wanted to flag that for folks too. So here's sort of the first group question that I wanted to ask folks on the line, and if you could just chat it into the side box, your response will give you 30 seconds or so to just chat into the box. But do any of you who are on the webinar currently help people apply for general assistance? And if so, where are you located? And if that is a yes, just put that in the chat box, like I help people apply, and then what county you're in. And if this is a totally new topic for you, also indicate that. I think this will be helpful to know kind of what brilliant minds we have on the webinar and kind of how we can share information. So.
Is that a typo? Cool.
So let's see what folks respond with. Okay, so we've got Dakota County, Lancaster County, Madison County, Sherman County. We've got folks in Thurston County. So good mix of people across the state. That's awesome. And we've got Douglas County as well. So a good mix of people. A lot of you sound like you have either come in contact with the program before, but just haven't maybe helped anybody apply, or you actively help people apply. Oh, we've got Hall County as well. This is great. Good, so we've got a good kind of diverse mix of folks across the state.
Can we talk about how every county is so different again?
Yeah. So we'll talk a little bit about kind of how that works. So every county really is different in both where you apply for assistance, the rules on it, where the rules and regulations are located, the types of services that can be accessed, all sorts of things. And so we'll go through some examples of that in more detail. But first, let's talk about what is general assistance. So general assistance is a public assistance program that's administered through the counties. State statutes govern kind of the baseline rules for the program, and then each county board has the authority to kind of create rules and regulations to flesh out how the program will operate. It is a program of last resort, which means that a lot of times you have to show as an applicant the other assistance option, and that you don't have a parent, a step parent, a child, or a relative who could provide you with that assistance that you're seeking from the county. So some counties will require the proof that, so for example, if you were applying for health care assistance through general assistance, some counties will show or require that you show proof of applying for Medicaid and being denied for Medicaid prior to being able to get that assistance. So we'll kind of walk through the state statutes, and bear with me, when I see a slide that has this much text on it, I immediately stop looking at it. So I understand there's a lot here, but I wanted you to be able to see it kind of all together, because I think that helps make the most sense. So we'll walk through each of them in detail, but these are what really sets out the existence of the program and establishes the program in the state, and then also sets out the obligations of counties in operating the program. So these are the rules that all counties have to follow in operating their programs. So as I mentioned, a person who applies for general assistance does not have a spouse, a parent, or step parent supporting them, and then also is ineligible for other programs. If that is the case, they're able to receive general assistance out of the treasury of the county in which they have legal settlement at the time of applying for assistance. So what does that mean? It essentially means that the county has to pay for the assistance for residents of that county. As I mentioned, there are a lot of really old cases on this, and a lot of it has to do with what happens if someone needs assistance in Douglas County, but they were traveling across the street from Scottsbluff County? Which county is responsible? That's where you get into that sort of legal settlement issue. But for the most part, what you'll see on applications is that there might be a state residency question, a county residency question to show that you're a resident of the county from which you're seeking assistance. The county, in the next statute, 68-132, the county board has this obligation to provide the assistance to folks who meet the requirements. And then they also set out standards for eligibility and for the types of services and assistance that are provided. When the county is setting out the types of services and the type of assistance that's provided, it has to be at this standard, which is adequate to ensure maintenance of minimum health and decency. So it really is not a high level of services or assistance that's provided. It's sort of this minimum baseline level. And we'll talk about what that means in practice in just a second, but those are kind of how counties decide how much assistance they will provide. Also, in 68-131, where they establish who could be eligible for general assistance, there's language around if a person is ineligible for programs because of their own actions or inactions, that they can be ineligible for general assistance. So what this means in a lot of counties is that if someone has become ineligible for a program like Medicaid or ADC or SNAP because of their own actions, so if they had an intentional program violation or if they committed fraud or something like that, then they would also be ineligible for general assistance. So this is the one that really lays out how the county comes up with what their program looks like. So each county goes through and adopts this written standards of eligibility and assistance. And each county has to provide the opportunity for all individuals who desire to apply. They have to have the opportunity to do so, and that all folks who are eligible to receive assistance must receive assistance within 7 days for a short-term need or 30 days for a continuous need. The difference between a short-term need and a continuous need, a good example would be someone who was facing an eviction and needed housing assistance. That might be a short-term need, or some sort of short-term health care crisis that they were dealing with, versus a continuous, more long-term need, and like an ongoing healthcare situation. The county then looks at what goods and services are necessary for maintaining this minimum level of decency and health. Then determines what amount of money or what amount of money is needed to obtain that level of goods and services, and then what amount of money will be paid out to folks who apply for the program and are eligible. So really setting how much money does it take to maintain this level of minimum health and decency? How much money does it take to buy the things that you need that, and then how much money should be paid out? They also set their own income and asset standards, and then they also designate if someone applies and is denied, or if someone gets assistance and that assistance is terminated, things like that. Whether the county board itself or whether there's designated county employees who will conduct a hearing around the termination or reduction of benefits. We'll talk more about sort of the hearing issues in a second, but as you can see, all of this is really dictated by the county. So each county has its own sort of schedule or list of what are the services that they deem necessary, and how much those cost, and how much what's the maximum amount of assistance that a person can receive. all of these standards have to be reviewed on a biennial basis to reflect cost of living increases. And then each county has to make the copy of the standards or any changes that they make on this biennial basis available for the public during normal business hours. If a county is going to change its standards, they have to have a public hearing first. So, questions for the group. Where do folks in your county apply for general assistance? The reason I ask this is that across the state, there's a number of different places where people can apply for general assistance depending on the county. Some counties have it set up through a county clerk's office. Some counties, some of the bigger counties have an office of general assistance. Some go through the public health department, and some community action agencies also do applications. So where do people in your county, where do the applications go? Also, do you know where the rules are kept in your county? Some of the bigger counties have them online. Some don't. It sort of depends. So we'll give you 30 seconds or a minute if you have thoughts on these questions. Okay, we have Midtown Health Center, you can apply. And then also the DHHS office located in the Falls City Courthouse is another place to apply. General Assistance Office, online. The General Assistance Office, or you can come to People's Health Center. Yeah, so some of the bigger counties have a General Assistance Office. And some of the health centers within Nebraska also do applications. You can do paper or online. That is Lancaster County. So as last responses trickle in, I'll just kind of share what I wanted to do in this discussion was to use as many local examples as I could possibly incorporate. I looked at the list of responses and registration for who was going to be here today, and I wanted to cater it as much as I could to folks who are going to be on the webinar. It turns out that I could only find information about where to apply for general assistance for 5 or 6 of the counties that I looked at. I just went through a list of the counties and tried to find it. So what I think as a consumer, this is not something that is really talked about much or is easily accessible. A lot of times it really is the program of last resort, and I don't know as a consumer how easy it is to figure out where to apply or what the rules are. So we've got a couple other responses. In Hall County, there's a referral book to resource whatever the need is. There's applications at the hospital and can complete the app and send it to the DHHS office. And the DHHS office in Dakota City also does it, or online. So there's a good mix of different places that folks can apply, and some have online capabilities, some is a paper app. I know some counties, like Scottsbluff County, you have to do a face-to-face interview with the general county or the general assistance administrator. Other counties don't require interviews. So I think it's important if you're helping folks apply for these, to know the ins and outs of what your county requires, or where some of the rules are kept, to help explain those things to people who are applying. So, eligibility for general assistance. We've touched on this a little bit, but just looking more in depth, like who are the folks that would be eligible for this program? They have to be low-income individuals who are ineligible for other programs and have no other support or way to meet the needs. It can either be a short-term or a continuous need. Like I mentioned, the difference between a short-term and a continuous need. A lot of counties ask citizenship questions or U.S. residency questions. There are also county residency questions on a lot of applications. The reason why we're talking about this now is that we're seeing kind of these examples of folks who would be eligible pop up a lot. So a lot of low-income single people with medical needs who, so if you're a low-income single male, no children, you don't fall into a Medicaid eligibility category. So if you have a health need, you wouldn't be eligible for other medical assistance programs. So general assistance would be the program that you would fall back to. A low-income parent who needs housing assistance might be eligible. So if you needed help with utility issues or with mortgage payments or rent payments or things like that, that would be a place where you could go. We see a lot of issues with federal housing aid, there being a lot of wait lists and things like that. So a lot of times folks will go to county assistance for housing issues. The reason why we have been talking about general assistance a lot is that a lot of the folks that are in the Medicaid coverage gap might be eligible for general assistance because they don't have, if they have a health need, they don't have any other way of meeting that need. So a low-income person without kids, even if their income is zero, would be ineligible for Medicaid, but would likely fall under the income limits for general assistance. And in some counties, a low-income parent might also be eligible, depending on their income. So here are just a couple examples. I knew there were folks from Lancaster and Douglas County on the phone for income eligibility purposes, but Lancaster County, and this is from, I think this is the 2014 guide, which was the most recent guide I could find, but some counties break down income eligibility depending on what folks are applying for. So if a person goes and applies and they just want healthcare assistance for primary care, then the income level is a little bit higher than for hospitalization or ER care. So it's a difference between 100% and 50% of the FPL. Some folks, or some counties will also then have kind of a separate category of rent or non-medical needs. And then in Lancaster County, that is below, again, the primary health care. For Douglas County, and this is the 2016 guidelines, it doesn't appear to be broken out into what type of assistance the person is applying for. It just is income below, for a one-person household, $525 a month, after certain disregards and things are taken into effect, and then two-person household below $540 a month. Each county, much like when you're applying for any sort of benefit from DHHS, there's a pretty intensive income analysis of what is considered income, what's considered a resource, what kinds of things are not considered income or are disregarded. And so the 100% number and 50% numbers for Lancaster County and Douglas County's actual numeric numbers, they reflect numbers after that income analysis of what is considered income and what is disregarded has been completed. And what is considered income in one county might not be the same as what's considered income in another county. So That is kind of just one example. What you'll see a lot of times is that income eligibility levels will be lower than what is available through DHHS programs like SNAP or Medicaid or TANF programs, which makes sense if a person has to apply for those first and be denied prior to being able to access general assistance. One other note too is that it's sometimes the county will build in exceptions to certain rules, and so it's important to know what those are, especially around, well, this isn't really an exception, but a lot of times for healthcare services, you'll have to get a prior authorization or go to a specific health center. And so you might have to go to the county health department to get your healthcare services or get prior authorization from a particular provider. With some of the other non-healthcare things, there might be, if you don't meet the income limit, there might be an exception for where you could get assistance if you were facing an eviction or utility shut off, or if you had a physical or mental health condition that prevented you from being able to meet your needs. So there are kind of little idiosyncrasies like that that are important to know. So what are the types of support that are provided by general assistance? Oh, okay, we have before we go to that, well, Cheryl just mentioned that for Richard County assistance, an applicant has to have less than $400 a month income and no more than $5,000 equity in their home, or they don't qualify for Richard County assistance. So that's helpful to know, and kind of goes in line with some of the other numbers that we just looked at, where it's pretty low, and those numbers would be lower than what you would see for eligibility for some of the federal programs administered through HHS. So what kind of services or support are provided by general assistance? Again, the scope depends on the individual needs of the person and the county that they live in. So these are things, depending on where you live, like food, medical services and prescriptions, housing costs, utilities, transportation, and then personal need items like hygiene items, laundry detergent, things like that. Some counties, so counties dictate the scope of their benefits. So some counties don't provide food because their income level is such that if you're eligible for general assistance, you would be eligible for SNAP. You should just go get SNAP instead of getting food assistance through general assistance. Other counties will provide food assistance, or they will provide emergency food baskets or things like that. With medical services, some counties provide dental and vision, other counties don't. A lot of that has to do with the robustness of services available in that area. Like if you have an FQHC or a federally qualified health center in your area that can provide some of those services, you might be more able to access those through general assistance versus if you live in an area where there isn't a low income dental clinic or something like that. For housing costs, some counties will provide rent assistance with mortgages, things like that. A lot of counties don't provide deposits, so they won't help you in terms of putting a deposit down on a new place. Some counties also will not provide you with mortgage or assistance or assistance on housing if you're facing foreclosure, and a one-time grant of assistance wouldn't help you avoid foreclosure. So if you were so underwater on your mortgage that a one-time the maximum amount of housing assistance that you could get through general assistance wouldn't prevent that foreclosure, they wouldn't provide it to you. With utilities, a lot of times, again, you'll have to apply for energy assistance or some of the utility assistance through HHS or through your local utility, and be denied for that, or it not meet the need. But there a lot of times are exceptions for things like utility shutoffs and in the winter or summer months when things get kind of extreme in terms of temperature. Transportation varies depending on where you live, again, and what kind of transportation infrastructure you have there. So in Lancaster or Douglas County, when there are bus routes, a lot of times you can get bus passes or things like that. In other places where there might not be buses, sometimes you can get assistance with like minor repairs on a vehicle or things like that. Personal needs items, a lot of times what will happen is when the county dictates their sort of schedule of what is provided or not provided in terms of support or what is needed for that minimum level of health and decency, they'll make a list of what personal needs items will be provided and then what things don't count as personal needs items. So they might have a list of things that say like shampoo, soap, dish soap, laundry detergent, things like that, and then have a list of things that won't be considered a personal needs item. So like dog food is generally not allowed, things like that. And then payments are made directly to vendors most of the time. So if you're getting rental assistance or mortgage assistance or something, the payment would go directly to the landlord, or in the case of medical services, directly to the health clinic. For personal needs items, counties a lot of times will have agreements with certain stores, and so you'll get a gift card in the amount that's determined to be necessary to a specific store. So I think I want to say in Sarpy County, it's No Frills, like you get a No Frills gift card. So that's a lot of what you'll look at in terms of being able to access assistance, again, will really depend on the county. Some examples of this is like I mentioned, a lot of counties don't provide food assistance, but also the difference in medical services can be pretty dramatic. Some counties, like Lancaster County, doesn't provide dental care, or does provide dental care. Sarpy County doesn't. Okay, so one piece of this that I think is really important and that a lot of people who utilize general assistance might not know about is their due process and appeal rights. So just like folks who are enrolled in SNAP or Medicaid or ADC have the right to notice and appeal a notice of a denial or a termination or reduction of their benefits, and then to appeal that decision, folks that are getting general assistance also have those rights. So in state statutes, if you have an application and it's terminated or denied or reduced, you are entitled to a written notice that explains the specific reasons for that action. And then you have a right to a hearing, and the notice also has to provide you with a process for requesting a hearing. The hearing would be either before the county board or a person appointed by the county board to hear these sorts of appeals. State statute also lays out your rights at a hearing, and so you have the right to present evidence. You have the right to bring an attorney or a friend or someone to represent you in the hearing if you don't feel like you could do that yourself. It has to be tape recorded, and there has to be a record of it, so that if you disagree with the result of that hearing, you do have the right to have that reviewed in district court of that county. So there really is a pretty good amount of rights that folks have in terms of appealing or getting notice for the decisions that occur in their applications. One last piece that we'll talk about on this is that counties may create vocational, rehabilitative, job training, or community service programs for quote unquote employable recipients. That's not language that I use or would use, but is the language that's in the state law about this. And what this really does is that if someone is unemployed, so working less than 25 hours a week, and their health status would allow them to work, a lot of times they are required to participate in like a job training program, a job search program, or community service type program in order to receive the assistance. A lot of times there are exceptions for like single parents of very young children, or again, people who whose health status would not allow them to participate in such a program. But it's important to know what that program looks like in your community. Some are a little more robust and active than others, but there is, similar to our ADC or TANF program at the state level, there can be a work element to getting general assistance. So with that, that's kind of the overview of how things work with general assistance. I'd love to hear more from folks on the line about your experiences or what types of questions you might have.
I have a quick question while we wait for them to come in over the chat box. So my big question, I'm just curious what kind of budgets these programs have in different counties that you have access to that information. Do you know any of that?
Yeah, so
or how many people are served each year?
Yeah, I don't know how many people are served, but I do know, so depending on the county, the budget can vary pretty wildly. What we'll see is, some of the smaller counties might budget $100,000 or something for this program. I know we've talked a lot in the context of Medicaid expansion and like what portion of general assistance services for healthcare would be eliminated if that population had coverage. And I know some of the bigger counties say that they could save $5 or $6 million a year. So healthcare is what's really going to drive up your costs. Sort of your one-time personal needs or rent assistance is going to be lower. So I don't know if that helps answer the question.
Yeah, so folks still have a chance to put any questions or thoughts in the box and get some answers before we close down, probably a little early.
I have a question for folks who help people apply for the programs. In putting together, okay, Cheryl just mentioned Richard County won't help with medical unless charity care is exhausted. And you'll see that, I don't think that's uncommon. Like I mentioned, the healthcare costs are what really costs the county the most money. And so a lot of times you'll have to go through basically every step to prove that you've exhausted every other option before you can get that assistance. I would be interested in hearing from folks. When I looked through, I hadn't revisited the rules on general assistance in a while, but or the state rules on them. But it seems to me some of these things were kind of surprising. Like I didn't realize how many rights that people had to appeals, or how many things counties have to do in administering these programs. But I didn't know if there was anything that any of you saw that you kind of thought were surprising or you didn't know or anything like that?
While they were writing their answers to that, I wonder, one more thing came up in my mind, but do all states have programs like this, or is Nebraska the only one?
I think most states do. A lot of these sort of came out or started prior to like the 1960s, where we started getting state and federal level programs. A lot of these go back to, like, if you read some of the cases, they're like the county poorhouse or like things like that, when people were like traveling and who would be responsible for their care. So this is sort of the first and kind of lowest level of assistance. So I think most states still kind of have a little patchwork of these left. Keisha said, I didn't know the standards are reviewed biannually. I also did not know that. And I think one thing that I noticed when I was looking through trying to find examples is that a lot of the standards either are not posted online, which makes sense if you're a smaller county and you don't have like a huge website, that wouldn't be the top thing to post online. But a lot of the ones that are posted online are old and not updated. Jen and Keisha also mentioned general assistance has been used to help provide transportation for a consumer who needed to get to a very important surgery. Yeah, I think that's a good point. I think sometimes some of the what we would call wraparound services or the barriers to getting care or to getting to work or getting some of the things that may not be encompassed in another program are things that general assistance will pick up. So if you're not eligible, or if you can't find another way of transportation to get to your health care, general assistance might be the place to look.
Well, that seems like we've answered everybody's questions. And I want to thank Keisha and HCAN for suggesting this topic and for everybody for being here. Thanks also to Molly for presenting to everybody. So this will be on our website at enrollnebraska.org/EEG, this recording of this. I also want to direct you all to upcoming webinars that HCAN and Enroll Nebraska are hosting. The next one is next week, and the one following that is in June 14th. So you can find all of those, as always, at enrollnebraska.org/events. And so I'd probably direct you there, even though those links will not work for you unless you pulled the slides down off of the website. So this will be up at enrollnebraska.org/EEG. And if there's nothing else, we will say have a great day. Thanks, everybody, for joining us again. Bye-bye.
Thank you.